Hello. We are now in 2021, so at this time, you or someone you know has probably experienced the coronavirus. As Americans, we learned about this vaccine in the early part of 2020, but the question that many want to know is why is this virus taking a greater toll on the Black communities, and what can we do to lower the risk in Black people? Since we first gained vital knowledge about this deadly disease, Black people have constantly been a target, and we're just now starting to slowly gain control of this. According to JMIR publications, while African Americans in Illinois account for 17% of confirmed COVID-19 cases and 29.7% of attributed deaths, they make up only 15% of the state's entire population. And in Louisiana, based on the 2019 census, 33% of the population is African American, but this group accounts for 55% of the total COVID-19 related deaths. After reviewing research on the pandemic, the African American population worldwide has the highest risk of death and other complications from COVID-19. Today, I'm here to tell you how we can stay safe and ways to dramatically decrease these numbers so that Black people are not at such a high risk for this deadly disease. First, I want to give you a clear definition of what COVID-19 is and how it affects the body. What is coronavirus? According to Yale Medicine, coronavirus is a family of viruses, and they're all known to infect people, and they get their name from the crown-like spikes called coronas that appear underneath the microscope. And why are African Americans suffering more? Also, according to JMIR publications, the reasoning is not clear and will require additional research after the pandemic has ended. There are some possible explanations for this pattern. African Americans historically have a higher risk for conditions such as diabetes, heart failure, and underlying cardiovascular disease. The higher BMI among African Americans compared to other groups, particularly whites, has been shown to be present in children and in adults. Other possible contributing factors of COVID-19 amongst Black people include how they're grown up in a lower socioeconomic status, crowded living conditions, living in densely populated parts of cities, reduced access to hygienic products, and the lack of PPE equipment. Black people simply lack access. The Black communities are struggling because we are denied the same access as white people. The jobs offered to us do not allow for us to work from home, and in most cases, there are lower paying jobs. So now you have most of your African American population serving as your essential and frontline workers, which put them at the greatest risk of getting COVID-19. However, the beauty that I find in all of this is that it is almost over and it will not last forever. But how do we stay safe until it is over? There are a few simple steps to follow. First, you want to make sure you're constantly washing your hands. You want to make sure that you never touch your eyes, nose, or mouth. You want to make sure that if you cough, that you cough or sneeze into a tissue and you dispose of it immediately. Limit your contact around sick people. If you do have symptoms of COVID-19, make sure that you stay in your home, and also constantly get tested so that you know that you do not have the disease for sure, because people can still be asymptomatic. But according to recent nationwide data from the CDC, 30% of COVID-19 patients in the US are African American, when only 13% of our population is African American. So, if you feel you are experiencing COVID-19 symptoms, stay in your home to reduce the spread of this deadly disease. We have been dealing with this pandemic for over a year now, so stay safe, mask up, get tested, and most importantly, get vaccinated.